You know that gnawing, burning pain you can get in your upper stomach? It can be really worrying, and it's so easy for your mind to just jump to the worst possible conclusion. But today, we're going to take a deep breath and break down exactly what's likely going on. So, let's get into this simple guide to understanding what gastritis is, and more importantly, the clear path to healing.
We've got a really clear roadmap for this. First, we're going to tackle that #1 worry about stomach pain. Then we'll figure out what gastritis actually is, using a pretty cool analogy. After that, we'll find the culprit, see how doctors treat it, and finally, walk through the recovery process step by step.
All right, let's just get right to it. Let's talk about the single biggest source of anxiety when this pain strikes. Because it's high up in your abdomen, it's totally natural to wonder if it's something, much more serious.
And this is it, right? This is the first question that pops into pretty much everyone's head. And that's completely understandable. I mean, your stomach and your heart are neighbors. They're located really close to each other, so it's easy to get the signals crossed. Okay, so let's look at the crucial differences, because they're actually pretty distinct. Gastritis, on the left here, it's that burning, kind of gnawing ache, and it's almost always tied to food. Either it gets better or worse after you eat. A heart attack, on the other hand, is a totally different feeling. It's a crushing pressure, a squeezing sensation, and it has nothing to do with what you had for lunch. Just knowing that difference can bring a huge amount of relief. So, if we're feeling a bit more confident that it's not your heart, then what in the world is going on inside your stomach? To make this crystal clear, let's use a really simple analogy.
Now, the official medical definition is inflammation of the stomach lining. But, inflammation is such a vague word. What does it actually feel like? Why is it happening?
I want you to picture your stomach's protective lining like a really tough, durable raincoat. Its only job is to shield the sensitive wall of your stomach from all the powerful digestive acid inside. And when that raincoat is in perfect condition, you don't feel a thing.
But with gastritis, something has come along and basically poked a hole in that raincoat. Or maybe it's just gotten worn really thin in one spot. The point is, it's not giving you 100% protection anymore.
And here's where it all clicks. That powerful stomach acid leaks through that little tear and comes into direct contact with the stomach wall underneath. That burning, gnawing pain you feel, that is the acid irritating the wall. That is inflammation.
Now, besides that burning ache, there's another huge clue. I like to call it the fullness factor. This is when you sit down for a meal, you're hungry, but after just a few bites, you suddenly feel uncomfortably, ridiculously full. That heavy, bloated feeling is a classic sign your stomach is irritated.
And this whole thing can show up in a couple of ways. Acute gastritis is the one that hits you out of nowhere, sudden, sharp pain. But chronic gastritis is sneakier. It builds up slowly over time, and you might not even realize what's happening until the discomfort is there pretty much all the time. Okay, so our raincoat is torn. The next logical question is, what tore it? Because finding that root cause is everything when it comes to the right treatment. Well, for most people, it really just boils down to one of two things. The first is a super common bacteria called H. pylori. It's a tough little bug that can live in the stomach and mess with that protective lining. The second big one is overuse of common pain relievers. We call them NSAIDs, but you know them as ibuprofen or aspirin. Taken too often, they can literally wear down that raincoat lining.
And the really good news is, finding out which one it is usually very simple. To check for H. pylori, doctors can use a super easy, totally non-invasive breath test. They only start thinking about using an endoscopy, which is a tiny camera, if your symptoms just aren't getting better with the initial treatment.
This is why it's so important to actually deal with it. If that irritation just keeps going day after day, that acid can wear away at the stomach wall even more. Eventually, that simple inflammation can turn into an open sore, and that's what we call an ulcer. So catching it early at this gastritis stage is really the key. So, how do we fix it? Well, the treatment plan is actually a really straightforward two-part mission. Goal number 1, reduce the acid to stop the burning. Goal number 2, get rid of whatever was causing the irritation in the first place.
Doctors have a few really effective tools for this. You've got antacids, which are great for a quick fix. They neutralize the acid that's already in your stomach. But for true long-term healing, they use meds called PPIs, or proton pump inhibitors. These are the game changers. They actually shut off the little pumps that make the acid. This gives your stomach's raincoat the time it needs to heal itself. And of course, if H. pylori is the bad guy, then antibiotics are the only way to get rid of the root cause.
And when it is that H. pylori bacteria, getting rid of it is a very specific mission. It usually takes a targeted course of antibiotics for about 1 to 2 weeks. The goal is to completely wipe out the bacteria so your stomach lining can finally start to repair itself without being constantly under attack.
All right, so the medication is cooling the fire. Now let's talk about the practical things you can do to help yourself heal and feel better for good.
Okay, if you're feeling that burn right now, here's your immediate action plan. Step 1, and this is a big one, stop taking any of those NSAID pain relievers. Step 2, cut out the obvious troublemakers, alcohol, coffee, spicy foods. Step 3, switch to really gentle, bland foods. And Step 4, make that call to your doctor to get a real diagnosis.
The whole idea with a gastritis-friendly diet is simple. Just be nice to your stomach. You want to give that lining a break so it can heal. That means sticking with things that are super easy to digest, like bananas, rice, applesauce, and lean chicken. And you absolutely want to avoid things that are acidic, spicy, or fried, because those will just light that fire right back up.
And please, be patient with your body. Healing is a process. You'll probably start feeling a bit better within the first week of treatment. Then, over the next month or so, you should feel consistent improvement as that stomach lining really starts to repair itself. The long-term goal is to feel significant, lasting relief after about 2 months.
And if you remember just one thing from all of this, please let it be this. Your body is on your side. Once you remove the irritant, whether it's the bacteria or the pills, your stomach lining has this amazing natural ability to regenerate and heal. Your body wants to get better.
So now that you have the roadmap, you know what's going on, and you know there's a clear path forward, what is one small step, one tiny change you can make today to start helping your body heal? Maybe it's just swapping that afternoon coffee for some tea, or maybe it's finally picking up the phone to call your doctor. Taking that first small step is the most powerful thing you can do.